Hi everyone, welcome back to SG Doctor Wellness. My name is Dr. Chen Yiming, and in this second video of this 4-video series on sleep and sleep disorders, I will be talking about snoring today. Why do people snore? Is snoring a sign of any disorder or disease? I will also share the 8 methods of reducing your snoring. If you're new to our channel, click on the subscribe button now. The back of our throat where the sound of snoring comes from is called the pharynx. The pharynx is located just behind our tongue. And normally when we are awake, the pharynx is held open by several small muscles. However, when we sleep, these small muscles relax and therefore the walls of the pharynx becomes much looser. When air flows through a relaxed pharynx, the walls vibrate and snoring occurs. The narrower the airway, the more easily it will vibrate and the louder will be the snoring. So how common is snoring? About 40% of men have at least mild snoring on at least some nights. This number is about 30% for women. People of any age can snore, even some children have snoring problems. But the age group most at risk are the middle-aged people. So what are some of the factors that can make you snore more? Number 1, obesity. Being overweight or obese will mean that you have more fat around your neck. This will make your throat narrower and it will vibrate more easily. Secondly would be your sleeping position. Sleeping on your back makes your tongue fall directly backwards, and this can get in the way of your airflow, and so snoring is almost always worse when you are sleeping on your back. Thirdly, alcohol consumption close to bedtime. Drinking alcohol will relax the muscles in your throat. This will mean more vibration and more sound and hence louder snoring. Fourthly, people who breathe through the mouth during sleeping are more likely to snore. This is because the walls of the throat at the back of the mouth vibrates more easily than the back of your nasal cavity. Some of the reasons why one would breathe through the mouth includes nasal obstruction due to adenoids or nasal polyps, nasal blockage due to chronic allergic rhinitis. Snoring can also be caused by other medical conditions resulting in airway obstructions, such as an enlarged tongue, enlarged tonsils at the back of the throat, even enlarged thyroid which can compress on the airway, a very small and retracted jaw. Certain medications intake like sleeping tablets, epilepsy drugs and oral steroids, anesthetic drugs even can increase your snoring. So, how can snoring affect you and your family? For many families, snoring may be a big problem. Often, the snorer has to sleep alone in another room. If not, then his or family will have trouble getting a good night's sleep. The family and the patient might be more tired during the day, and this can mean that they can't focus as well on work or during studies. Some snorers also have a condition known as obstructive sleep apnea. Over 10 to 20% of regular snorers have this condition. Sleep apnea is linked to high blood pressure, heart attacks, and strokes. To learn more about OSA, click on the link on the top right of your screen now to view my previous video. I will now share some of the treatment and management to reduce snoring and improve sleep. The key to reduce snoring really is to identify the cause of your snoring. Firstly, if you are obese, then weight loss would be the most crucial step in reducing your snoring. Reduce calorie intake by reducing 20 to 30% of a meal size. Increase your exercise duration per week gradually to eventually hit 150 minutes a week. 2. If you have allergic rhinitis, then see your doctor to get it managed. Treatment of allergic rhinitis includes avoiding dust, regular medicated nasal puff, and even oral antihistamine to reduce the swelling of your nasal turbinates. And this will definitely help in reducing snoring. Third is your sleeping position. Lying on your back makes the base of your tongue and soft palate collapse easily. Sleeping on your side may prevent this. Using a body pillow, which is a full-length pillow that supports your entire body, provides an easy fix. Or you could try to simply elevate your head by using thicker pillows or more pillows. Fourthly, limit or avoid alcohol before bed. Alcohol and sedatives reduce the resting tone of the muscles in the back of your throat, making you more likely to snore. Drinking alcohol 4 to 5 hours before sleeping makes snoring worse, so please avoid that. Fifth, get adequate sleep. Insufficient sleep or poor sleeping habits have an effect that is very similar to drinking alcohol. When you're overtired, you sleep hard and deep, and the muscles at the back of the throat becomes floppier, which creates snoring. Hence, please watch my episode on the top 10 ways to sleep naturally by clicking on the top right of your screen now. Sixth, oral appliances or spleens. One treatment is called the mandibular advancement spleen. It looks a bit like a mouthguard. You wear it between your teeth while you sleep. It pushes your lower jaw forward, and this gives you a wider airway at the back of the throat. It needs to be specially fitted to you, and therefore you will need to see a dentist or oral surgeon for this. Seventh, medical interventions. Some treatments stiffen the root of your mouth, and this makes it vibrate less. This can be done using lasers, injections or implants, or even surgery. If you have seen an ENT doctor and you have been diagnosed with enlarged adenoids or tonsils, then surgical removal may be part of an effective solution to reduce snoring. Lastly, make sure you exclude obstructive sleep apnea. Problem snoring may be an early warning sign that sleep apnea is present. Again, see my previous video on obstructive sleep apnea, get it diagnosed and treated. So there you go. Thanks for staying till the end. Snoring can be a big issue. Identify the cause of it and get it treated. Subscribe, like and share, and in next week's video, we'll be sharing more about restless leg syndrome. Till the next time, stay safe and stay